channel. My name is Dr. Cooper Dogry. I have been practicing medicine for many years, and I have spent the last many years educating patients on a holistic approach to health, nutrition, exercise, stress management, and spiritual renewal. And that's how I have been able to impact patients on changing their lifestyle. I have patients who have dropped all medication and are doing well, reverse their diabetes, their blood pressure, have lost weight, reverse fatty liver. So I want to be here to give you some of these stories. Now, just remember that when you started changing lifestyle, and before you start adjusting your medications, you need to have a relationship with a healthcare provider. And the healthcare provider will assist you with tapering you off your medications. So what do I do? Prior to 2010, I used to be like any other doctor. Patients come into my office. I would evaluate, make a diagnosis, and treat with medication, injections, or surgery. But in 2011, my city, Rio Grande Valley, this metropolitan, became the fattest city in the United States. Consequently, we are the epicenter for diabetes and, of course, fatty liver, kidney failure. And I realized that I could no longer continue to practice medicine the same way. So I started Cooper Wellness Center, where I take patients through 8 weeks or 12 weeks to wellness program, teaching them health and nutrition exercise, and have educated them on how to take control of their health and have done well. So you're listening to me, you may have diabetes, and you're wondering, how can I decrease my insulin? Is it really possible to reverse diabetes? Absolutely. So how can I do such a thing? Well, type 2 diabetes is a lifestyle disease. Maybe 90% of patients who have type 2 diabetes can actually get off their medication or reduce their medication or reverse their diabetes. And you may be wondering, so are you sure about that? Yes. Type 2 diabetes, the majority of people with type 2 diabetes may have insulin resistance. Insulin resistance is when there's just two, in simple terms, the patient is producing insulin, but the insulin is not functioning at its best. Now, the insulin is produced by a small gland that is called the pancreas. When you consume your meals, there is stimulation, sensation to the pancreas saying, hey, there is sugar now in the blood. Let's produce insulin. The beta cells produce insulin. And then the function of the insulin is actually to take the blood sugar from the blood, take the sugar or the glucose from the blood, and take that into the cells. Now, if you don't have enough insulin, then the sugar in the blood will increase. If you have enough insulin, but the insulin is just not working well, you will have the same problem where you have blood sugar increasing, the blood cells, blood sugar to produce energy, the cells are just deficient. So, how do you get rid of insulin resistance? That's one of the causes of diabetes. Well, you have to decrease weight. It is, studies have shown that excess fat inhibits the function of the insulin. It knocks on the door of the cells and say, hey, I have some sugar to take inside. But the cells are just not responding because too much fat might be sitting there on the outside, inhibiting the function, that key to connect and open the door to taking insulin. So studies have shown that if somebody decreases their body weight by 5 to 10%, that can actually improve your overall health. You will increase your insulin sensitivity. The insulin will now start function better. How can you then? Are there other ways to decrease your glucose level? Absolutely. Studies have shown that over the last 40 years, Americans have increased the consumption of fat and fats and oils by 66%. If we're consuming too much fat, too much, then we are going to increase our weight. Why? Because fats and oils, they're just high in calories. So consuming more fats increase calories. If you're consuming too much calories, you are going to gain weight. Studies have shown that if you consume 500 extra calories in 1 week, you're going to gain a pound. And you're going to keep adding the pounds. So one of the ways in which you can lose weight and therefore impact your blood sugar level is by ensuring that you're consuming just the amount of calories that you need for your body size and for your activity. If you're consuming too much calories, it means that you're going to probably gain weight. Now, a lot of people consume their calories in liquid form. You know, sodas, one can of soda has 16 teaspoons of sugar. So sodas and drink, concentrated drinks, you're going to have problems with your weight because you're going to consume too much calories. Just look at this. We have also all these fast food chains. And of course, you walk in and you order these processed foods. So you get a burger and you get your fries. The burger has extra cheese. It has double Whopper. And then you put on the mayonnaise. That one meal that you're consuming could be 1,000 calories. And then on top of that, you get a soda, a large soda, extra large drink. And then you said, okay, I need a shake. So before you're done, you may be consuming 2,000 calories in that one meal. Consuming 2,000 calories in that one meal, and then you have supper to consume. Then in that particular day, you may be consuming 4,000 calories, and your body may only need 2,500. Where do you expect that extra 1,500 calories to go? You're going to store that as fat. And this is where the cycle begins. So then we have to ensure that you monitor your intake, decrease calories, consume food as grown, whole foods, forget processed foods, very important, and of course, better quality food. Stay away from the chips. I'm sure you all know that. So, the type of food, the amount of food, and even when you consume food, that's important. When are you consuming your meals? Are you consuming your meals too late? And therefore, you're not giving your body enough time to use the calories that you have put into your body.